Hello, my outstanding friends. I have some fabulous news for you. We are at the National Institutes of Health. Now, this is a government agency, NIH.gov, and they say get the latest public health information from the CDC and get the latest information from NIH, staff guidance and so forth. Now, let's see what is the latest information from them, because they just put out a paper a couple of months ago, and I think it was March or May, somewhere around there. Hold on. Okay, this is the paper I just mentioned, and I must say I was pleased to see that the National Institute of Health and the CDC and so forth, they're looking into probiotics, which are the good bacteria that live in the membranes of your body, primarily in your gut, but they transfer out to all your membranes, into your nasal passages, your saliva, every single part of you has to be separated from all the bad stuff, because you're completely covered with bad stuff every day. Sometimes a real bad guy comes along like COVID-19, and then you really want to be protected. Now, what do they say? Probiotics in the prevention and treatment of COVID-19. Now, I'm just going to go right down to the bottom where we get to the conclusion, because it's very long, but it's extremely interesting. For me, I found it absolutely fascinating. Now, the bottom part, the conclusion, is always the best for me. I always like to see what they conclude first, and then I go back. I go backwards. That's my way. Now, what is the conclusion? It says the evidence supports probiotics' role in regulating the immune system. The immune system keeps you from getting sick. That's what the immune system is. It keeps you immune. It suggests a definitive role for probiotics in viral infections. Well, COVID-19 is a virus, a viral infection, so it's definitive. That's a pretty serious word. Let's just see exactly what that means. Now, that wasn't my word. That was from the CDC, the NIH. It says definitive is serving to decide or settle finally, conclusively. So they have conclusively decided finally that probiotics plays a role. It's a definitive role. So there's no question now, it's conclusive, it plays a role in COVID-19. That's what they say. Now, that's not what I say. That's what we just read. Let's read it again. Okay, my friends, we all know in the news this new Delta variant is very contagious and very aggressive. And what about our kids? How are we going to help the kids? They're looking into this very contagious Delta variant, and the kids can't get the vaccines, and a lot of people can't even get the vaccines. What really do we need to do is to enhance the immune system. So if you're immune means you don't get it. If you're immune, you don't get it. So how do we make you more immune? We may not make you 100% immune, but if we can make you more immune and able to withstand the onslaught because your immune system reacts positively. And right now, there's a lot of people who have these, what they call pre-existing conditions. I'm going to show you what they are and why they have them and why probiotics are pretty much what we need to do to reinvigorate the immune system. Okay, this goes back all the way to 2011, and they're talking about probiotics and immune health. Now, this is the National Institute of Health, and they said, yes, absolutely, beneficial effects of probiotics have been demonstrated in many diseases. Now, this is 2011, and you cut to the chase down there, and it says, yes, we've seen what appears to be a good response from probiotics. Now, let's look up at this is 10 years ago now. Okay, so same people, 10 years later, this is 2011, this is just a couple of months ago, March 19th, 2021 now, and they're back at probiotics and prevention, treatment of COVID-19, and what are the prospects? Now, let's go right down to the conclusions, because otherwise we'll be here all day. Evidence supports probiotics' role in regulating the immune system, suggesting a definitive role for probiotics in viral infections. This is a viral infection. Definitive means absolutely 100% certain probiotics have a role. I'm not hearing anything about this. I want to see the kids not be damaged, and I'm going to show you what damage does occur from COVID. I've been following this very carefully right from the day they first had the first outbreak of it, and they did the first autopsies, and I could see what was happening to the fibers in the lungs. Okay, this is brand new research, so this is something that most doctors don't know about yet. Interstitium is a complete layer that coats all of the organs and every separation of every tissue in your body from other tissues. Nobody really knew about it until just recently, and it's just now being looked at closely. Now, they're talking about all this stuff. Let's just get down to it, like I cut to the chase. They thought it was like between each layer you have to have a separation. They know this, no question whatsoever, but they thought it was like a piece of plastic, like a little plastic bag wrapping everything. Well, it's not. It's a series of fluids-filled spaces, and they supported by these collagen bags. These spaces are now called the interstitium, and they think they're just like a shock absorber. Well, it's much, much, much more than that. They are, first of all, the springs that open and close these membranes and all that stuff in your lungs and everything. There's a very springy collagen. I'm going to show you these interstitium in a second, and then you'll see there's a brown strip that is a really springy part, and that's collagen. I believe it's 3. I'm not sure. It's one or the other. But when you get acute respiratory distress syndrome, one in 3 are the 2 collagens we're going to be looking at in a second. One of them turns from 2-to-1 ratio to a 4-to-1 ratio, or 3 or 4-to-1 ratio instead of a 2-to-1. So that's the real springy one. It turns to the floppy one turns to a 4-to-1 ratio instead of a 2-to-1. So it just gets real saggy and floppy, and then you can't expand your lungs. And then those brown springs will break and float through the system. I'm sure I'm going to talk about it in a minute, but I hope I do. Here it comes. All right, here's the nuts and bolts of COVID and most diseases. You have that layer of separation, which they call a mucosa. Even your skin is the same sort of thing. If you get invaded, you need something to fight back. I have cuts all over me all the time. So I have good bacteria coming back to fight back against the guys. You know, it gets a little red, but that's all right. Now, in your body, the same thing happens. You have stuff coming through there, and you have to have the good bacteria in here. Well, when you don't have the good bacteria, you had antibiotics that killed it. These springs break, and because they can't withstand the attack from COVID-19 specifically goes after this particular collagen. It makes this pink stuff go 4-to-1 instead of 2-to-1, and this one, I don't know what happens to it, but it's, just put it this way. I saw what happens I can see it. It's called fibrosis. It's fibritic. The fibers are all broken up. That's exactly what it is. And even like cystic fibrosis and things like that, I would look at probiotics for all of this stuff to start with. It may not be the cure, but I'm going to tell you right now, these long-hauling kids, they're going to be in it for a long, long, long time because they break these springs. Now, I don't know how easy they are to replace. Will your body just automatically come back and replace them, or will you be forever a little weakened? Because the kids seem to be able to survive the lungs, but they're actually getting COVID toe, where these little brown things, I believe, are floating through that fluid-filled spaces and ending up specific gravity at the toes, and they can't get through the little tiny blood vessels from the artery side to the vein side, and they get stuck in the middle, and then you get all red and nasty, and they're getting that, and they're getting skin conditions and all kinds of stuff because they're not dying from the lungs. Older people already have weakened lungs and they have weakened hearts and all that stuff. And if you're immune compromised, that means you're already open to invasion. It's basically that simple. Now, I hope this helps some people. I really, really do. And that's all I'm here for, is just to try to make it so that somebody will step up and look into this. I mean, here's 10 years ago, just a couple of months ago, and I looked into the study they did on this, and there's no results on it. And that was over a year ago, and the study was concluded several months ago, and I saw there is no results posted. So I don't know what to think if somebody is really doing any work on this, because they said there is no current randomly controlled trials. It's what I read in that paper. Yeah, here it is right here. This is again National Institute of Health. And, this is like I say, 10 years ago they knew about the probiotics, and now they're looking into it again. And it's the conclusion, I go by the bottom again, it says it supports the probiotics role definitively, no question whatsoever. And then it says, therefore, supplementation of probiotics in high-risk, severely ill patients and frontline health workers might limit the infection and flatten the curve, COVID curve. However, there are no randomly controlled trials to demonstrate conclusive evidence. I wonder why they didn't do any. But it says, on the other hand, circumstantial evidence has supported the presumption that probiotic supplementation decreases the severity of COVID-19 responses, including mortality. I haven't heard anybody say anything about it. It says many clinical trials are underway globally to delineate the role of probiotics in both prevention and treatment of COVID-19. I can't find any. Maybe you can find some. The one I said, there was one that they did, and there's no results. So, it's really kind of hard to believe they're not talking about it. It's right in here. I keep missing all the positiveness. Probiotics induced suppression of the inflammatory cytokine response may prevent both the severity and the occurrence of acute respiratory distress syndrome, making probiotics an attractive adjunct. That means an additive. I'd like to see this done. I'm not pointing any fingers. I know everybody's doing what they're told to do, but I say, you can go out and buy these probiotics yourself today. And I take a certain brand, and I'll put a link to the ones I take. And I'm not promoting anybody, but you have to get as many different strains as you can and quantities in you to overcome the strains and quantities that are trying to attack you. Basically, it's push to shove. Okay, my friends, this is disturbing. I understand the doctors are doing what they think is best, but they have to understand the immune system is this probiotic stuff. And they're giving them antibiotics as a precaution, thinking that the antibiotics will kill any bacterial infections. And it really didn't help at all. It only made things worse. So they're not doing it anymore, I don't think, a lot. And it said the study to date, it says right now that they're worried they're losing the progress they've made at slowing down the use of antibiotics, antibiotics. And what happens is they think they're creating new strains of bacteria resistant, antibiotic resistant stuff. Well, the person's so invaded that you can't, antibiotics not going to help. It's only making the thing worse. So they're going backwards anyway, right from the beginning. They shouldn't be giving them antibiotics. They should be giving them probiotics. So they're concerned, though, that they're going to give them more antibiotics just because they think it's a good thing to do when you get invaded, and it's not. It's just the opposite. So they say it's still going on to a certain extent, but it's improved. Originally, they were giving them pretty much the studies that they mostly to medical practices using the first 6 months of the pandemic. Since then, doctors have had effective drugs to reach out for, so they rarely get secondary bacterial infections. So it's reduced the automatic impulse to grab the antibiotics. But they say it's still going on. The lessons have likely been learned in most places where COVID-19 is treated. The researchers at Pew are eager to see results from follow-up studies to see if that is indeed the case. And we need to look at probiotics. That's what we need to look at. And they're not doing the studies that I can see. They apparently did one a year ago, or a little over a year ago, and they still have no results from it. And it concluded several months ago at least. I would think they could get some results out of that test. I'd like to see what the test reported. It's hard to believe that it's not taken more serious, because they already knew about it, as I showed you or will show you. The articles that were written by the National Institute of Health said, yeah, absolutely, And it said conclusively, definitively, probiotics play a positive role in the immune system, and apparently in COVID-19 is what they said, exactly with viral infections, exactly what they said, not me. Boy, you talk about timing. I was just about to get this finished up, and I got this from my friends talking about COVID toe and following a vaccine, which is the, I believe this is a Pfizer. And could the Pfizer be giving people, a problem? And with these COVID toes, he said, yeah, injection with Pfizer BioNTech 162B2. I don't know, I guess that's the Pfizer one now. And apparently this woman said 4 days after getting the injection, and they couldn't find anything other, and no other issues with her. You could read this whole thing, but to get down to the bottom, here's where they found pretty much the same thing I found. They couldn't find any issues. Therefore, she was advised to initiate an anticoagulant therapy, which, makes your blood thinner. Low dose aspirin, so it gives it more, fluidity to the blood. And then it says, in fact, COVID toes may be related to microvasculitis, endothelial lesions, microthrombosis, fibrin and immune reactant deposits on the vessels. All right, with lymphocytic infiltrate, predominantly CD3, CD4, whatever that is. In addition, it has been shown that SARS-CoV-2 could induce vascular damage with spike protein found in capillary endothelial cells. If they have a lot of spikes and they're very, very fine little capillaries, I mean, they're tiny, tiny. They just squirt out like one blood cell at a time, just about. So if these things are bigger than that, maybe they're causing trouble with that. Who knows? They call them spikes. So it says, with spike proteins found in capillary endothelial cells of the upper dermis in a series of 7 patients in pediatrics, pleading for the same phenomena in the present case. So wherever you have these little tiny, because people are getting skin conditions and so forth. Now, I'm not saying it's from the vaccine. They're talking about this particular case. I don't know if there's a lot of them, but somebody confronted me on this, and this is just from May of 2021. So when I get confronted with something, I look into it, and I don't hide from anything. Now, I don't know what's the cause is here, but are they being cured? That's what I want to find out, what the cure is for COVID toe, and do they just have to flush them through the system? Is it, because I've seen COVID causes that fibrous. You're supposed to have these little bags, and they're all supposed to be nice, as you saw that layout. I'm sure I showed it to you. Well, all of a sudden they're all broken up like this, and the bags are sort of draining willy-nilly and not like being stretched. Now, I assumed, that's all I can do, is that the springy brown fiber part broke and little bits and pieces are floating through. That's my take on it until it can be viewed under an electron microscope at the toe point. Nobody's going to know. Now, the other thing is there's going to be a specific bacteria that's in your toes. It's not in your mouth and in your intestines and so forth. And stink toe, people have their toes, sometimes they have a little odor there. Now, there's a different bacteria down in that area, and that's got to be serviced correctly, because you really shouldn't have a whole lot of odors unless something is primarily not the right pH, so some other thing comes over and takes over. The pH level has to be just right in that particular area, and that calls for blood flow and all kinds of things. It's a complex web of intricacies that makes everything work correctly. But without the bacteria, it's not going to work. I don't care what you do. It's not going to work until you have the bacteria in your body, which is your probacteria, probiotics. And it's pretty well established now And you saw the articles. I'm sure I've showed, I know I did. So I'm going to leave it at this, or maybe not. Depends. We'll see. You know, after seeing this, I would like to see somebody do a random control trial and see if there is, because they said there was no other issues. They couldn't find any of this COVID in the other tissues of the person's body. And she presented sudden toe pain, walking impairment, itching at night. Appeared 4 days after the first injection with Pfizer. She was otherwise asymptomatic, especially with no ear, nose, throat symptoms, fever, nasopharyngitis, no SARS-CoV-2 polymer chain reaction, was tested twice negative. Physical examination performed 10 days after the vaccination revealed non-tender violaceous toes, that's the COVID toes of the left foot, without any other dermatological lesion, especially no exanthelma, while cardiovascular and pulmonary examinations were strictly normal. So it's standard biological test performed at the beginning of symptoms revealed no abnormalities. White blood cells lipid profile were strictly normal. And they come down and they came to the same conclusion that I come to, that it has to be some fibritic, right down here. It says, in fact, COVID toe may be related to the microvasculitis, endothelial lesions, microthrombosis, fibrin, and immune reactant deposits on vessels. I think I went through this before, but I'm not sure. I just want you to be sure. I don't know. I have no clue about this, but I would like to see. These are the kind of things you have to do a random controlled trial. It's not a big deal to do that, but they have to get their hands around this and get a team working on it. They're spending, I mean, people are dying and not understanding, and then they have the random controlled trials not really being done about the probiotics. That's kind of hard to take. It's time to really do something about this. You have to speak up, because I can't, nobody listens to me. But I'm showing you the evidence that they themselves have put out. And, these things get lost. All of these journals, like this is a journal from Oxford Academic. The other one's for the National Institute of Health. Nobody reads them. So they just linger, and then 10 years later something happens. Oh, yeah, we know about that. Well, have another nice 10 years. And then that happens again. So I don't know what to say other than that right now this is pretty important to look into the probiotics and do some tests on these broken fibers. What are these fibers and what do they consist of? Where are they coming from? What changes in the body? And I've seen, if you look at the COVID lungs autopsies, yikes. And I know what's happening. It's eating into the specific type of collagen that works in the rubbery areas in your body. Because some collagens are tough and stiff, and part of it is tough and stiff, and part of it's real floppy. The tough and stiff stuff is supposed to bring back the floppy stuff after it bends, and then it comes back, bends, and it comes, well, spank, and it breaks. Then it's floating around, and sooner or later it gets caught somewhere. I believe that's the case. I could be wrong, but it doesn't sound like they looked that well, because they said it could be that. Now, I would think you'd look at that so close enough to say, yes, it is or it isn't, but that's just the way I do things. I don't know. Anyway, let's hope for the best and do what we can. So you're going to have to speak up about this. And probiotics are over the counter, so if you want to take them, they're there. Nobody can stop you. And in my research, I have found that nobody has had any issues with them. That, maybe some little, they bothered my stomach, I pooped 10 times or something like that, that type of thing. Well, maybe it does. Maybe it's trying to fix you up. Maybe it's not. I don't know. But I haven't had anybody have sickness from it. Maybe like a day or two of uncomfort, but that's about tops. And that's very, very infrequent as far as, I have 110,000 people on my site, and not a lot of them are really looking at this or thinking about it, but it's got to be at least a couple thousand that have interacted and spoken pretty much positively about probiotics. I can't think of anybody that's really complained about them. So the evidence is there. Do as you think best, but I think we should be hearing this from our leaders. That's what bothers me the most. We're hearing all kinds of other things and nothing about the probiotics, nothing about your innate immune system, because that is the whole basis of your health system. It's not just the COVID. It's everything that infects you. That's why people get infected. They get cancer. They get diabetes. They get heart problems. They get eczema. All of those things, if you look it up and put in and gut distress or and digestive disorders, they'll tell you if you have that disease, this is what you're going to have. If Crohn's disease, irritable bowel disease, all of those things, all related to digestive issues. And digestive issues, in my world, are related to the good bacteria that's supposed to be there to do that invasive chemistry is not there. So you become the invaded.